Hi, I'm Dr. Adriene Laura, and I am a Harvard-trained obstetrician-gynecologist, an expert in sexual medicine for women, and I do cosmetic surgery, and I also practice regenerative medicine. Hello, my name is Dr. Adriene Laura, and a lot of you know me as a Harvard-trained obstetrician-gynecologist, and I am. I also do cosmetic surgery and regenerative medicine and sexual medicine. I think those all encompass a woman's needs. But what I recently trained in, and I think is going to augment, enhance, and improve my practice, is intuitive life coaching. I learned how to listen to people and how to figure out through my technique of questioning, of observing, of encouraging, how to figure out what people want for themselves. And it's an amazing tool to use in any aspect of your life. But as a doctor, I find that patients are able to tell me more about what they're feeling, what they want, what they think is going on. I used it before, but not as organized as I'm going to be and have been since taking this course. So what it did was it took this kind of practice of mine of intuition, which was like this, it aligned it and made it stronger with tools to use it. So I think that probably anyone in life who wants to be more effective with people, just effective with people, and who doesn't want that, should be able to take this course and use it. Actually, Katya, the instructor and the founder of Kate, brought me to the program. She's a dear friend of mine, and she suggested that I come to the program because she said, she didn't just say I would enjoy it, she said I needed it. And I thought that was really funny when I heard it was about intuition. My personal feeling as a physician is that healthcare providers have inbred intuition that they pay attention to. They sort of have to if they're going to take care of patients. They have to be intuitive about how the patient feels, what the patient wants and needs. And so I was thinking, I don't really need this. But as I began to work with the program week after week after week, I recognized it was so much more than I ever thought it was. The program impacted me, let's say, divided into professional and personal. First of all, I didn't think there'd be any personal impact, and I would venture to say at this point that the personal impact was much greater than the professional. So the personal impact was, I realized in order to be intuitive and an intuitive coach for others, you had to look with your own intuition into yourself. I didn't recognize that was part of the training, but as I did that, I came to really honestly look at myself because I was in a safe group of people that I felt I could trust, and I was able to reveal things like guilt and shame and, fear. And I was able to get those things exuded from me so that I've actually changed and transformed through the program. So I think I'm a better me because I'm more accepting and forgiving of myself. And also, I'm a better listener. I don't know if you know, but doctors talk really fast to you when you're in the room, and they don't often stop and listen. I now stop and listen, not just to my patients, to my son, to my mother, to my sisters. I stop and listen attentively to every one of my patients and every one of the people I run into. And it makes me a better person for that. So professionally, again, I think I had said that I think doctors inherently are intuitive. They sort of have to be to take care of people. And I thought, I've got all this down pat. I'm very intuitive. But again, some of the skills that I learned in my class for Intuitive Life Coach taught me techniques. And that was something I had never had. No one ever taught me use open-ended sentences. Allow the patient to respond. Don't respond. Leave an empty space for them to respond. No one ever taught me to do some breathing exercises to calm a patient before I talked to them. I mean, in and out, I had done some of those things, but to pull all that together, to take my intuition, which I felt was innate, and then give me a bunch of tools, brought not only everything in alignment, but it strengthened my intuition and has made me a better doctor. I, hands down, 100% think that this course would be very useful for healthcare providers for the same reasons that I alluded to. In other words, we all, good healthcare providers, have some intuition they use with patients. They try to figure out what they need, what they want, and they use not only medical skills, but they have to listen to the patient. So what they don't have that I now have is an organization, a kind of purse stringing together all their skills about intuition, learning techniques to be a better intuitive coach or a better intuitive listener, and really read between the lines as to what the patient is saying to you. So I think all healthcare care providers, all people probably who do human service providing, could use this to grow not only in their personal care for people, which would make it all better, but also in business and other aspects of life. If I knew someone who was considering the program and they come up and ask me, what do you think of this program and do you think I should take it? I would say my short answer is yes. My long answer is, if you're interested in knowing more about yourself and understanding yourself and searching and finding the better life and how to get there, good. If you are looking to help others, good. If you are looking to help others attain the life that they tell you they want or that you discover they want and help them to get there, good. If you just want to improve the life of yourself, the people around you, and your clients, good. Then you should take this course. And after all, who wouldn't want to do all those things?